Vlad Voiculescu, who comes from the same organization as Mr. De Lorenzo. So I'll ask you the question a little bit differently and revert to the original statement at the opening of the panel. Standards and respectability and perceived independence is very critical to how patient organizations work, either at European level, at national level. How do you go about European level, but also interacting with, as we heard, with the member organizations from member states? How do you ensure that the integrity of that entire chain?
Thank you for this question. I actually come also from a grassroots organization here in Romania, and I've been on the board of ECPC, the organization led by Professor De Lorenzo for almost 2 years now. That's the European Cancer Patient Coalition in Brussels. A lot has been said about what ECPC is doing on European level. Coming back to Andrei's question on how we make sure that one of the trickiest, one of the most sensitive questions, which is the integrity of cancer patient organizations. How do we deal with that? I think the very nature of this very special consumer organization, so patient organizations are nothing else than a consumer organization with special needs and with special situations. I think they are very much dependent. They are very much dependent on the financing from the industry. There are very few grants and very few other sources of finance. So that's a reality in Europe, that most of the cancer patient organizations and patient organizations as such are being financed by the industry. Now, what makes a difference there, I think, it's to be very transparent about it. And we've seen at the very beginning of this panel the EMA criteria. So, and they're very clear about that. So you have to have a clear strategy. You have to be very transparent with regard to your members. You have to be very transparent with regard to your sources of funds. And you have to have enough different funders so that you are not, so that nobody can consider that you represent the interests of one stakeholder group or one pharma, right? And I think that's something everybody has thought about at some point. But the main difference is having their own agenda. The patient organizations have their own agenda, and that they go for it. And sometimes the interests are aligned with the industry. Many times they are not. Sometimes we have the same interest with the state authorities, with the regulatory authorities. Other times this is not the case. I think what really makes a difference is to have a clear strategy and to follow that strategy, which should be, as I said already 2 times, very transparent and in line with patient interest. Now, what I would like to mention from my experience on the national level and the European level, Professor De Lorenzo already mentioned the huge differences, the huge disparities between some countries in the European Union and others. What has not been mentioned on the slides you've seen, or the slide you've seen earlier, is that the upper part was Western Europe, was Western Europe, and the second part was Eastern Europe. So you've seen that difference. The differences for the access to innovative drugs go for a couple of months to years. The differences are unfortunately not only there, and I think there are some low-hanging fruits that patient organizations have to fight for. There are shortages of essential cancer drugs. There are shortages of essential treatment like radiotherapy, which is essentially where the costs are much lower actually than anything else. And we think it's unacceptable that this is not available to patients in this part of Europe. If you look on a map of Europe where the radiotherapy facilities are being shown, you'll see that Romania is by far at the very end on that list. The differences are, so we have per capita about 1/10 of the radiotherapy facilities that we should have, which is simply unacceptable. There are lots of changes ahead, and patient organizations have evolved from offering psychological support to other patients, to being active in research, being active with the regulatory bodies, and I think the trend is that patient organizations will be involved more and more, and EMA is the European Medicines Agency, is very much a good practice example there, which I hope will be followed by authorities also in this part of Europe. Some of the changes that will come. We talk about personalized medicine, we talk about innovative treatments, we talk about a totally different approach and a totally different relationship between doctors, authorities, and patients. I think many of these challenges and these changes will never come unless they are being brought about by patients and by the civil society at large. And I think I always bring this example that I consider just involving just patient organizations in the discussion, or consider that just patients are asking just a patient's opinion on the healthcare system. It's like asking truck drivers with regard to motorways. So you don't ask the opinion just for truck drivers if you talk about motorways. Everybody is interested in that. I think the civil society at large should have a much higher interest in the healthcare systems and how things are going there. Thank you.